Okay, this is a taping technique that we can use for what we typically would call ankle impingement, basically where there's a pinching sensation. Usually it's caused by landing short a lot, but you tend to have pain right here in the front of the ankle. We're gonna show you a few techniques. One is using a product called Cover Roll, and it is made by BSN Medical. You can actually find this product in differing widths on Amazon. And actually they do a combo with this Leukotape, which is what we're going to use, Leuko tape. It's a very rigid tape. This is not the same as your typical white athletic tape, so it will need to be a very rigid tape like Leukotape. These come in a combination purchase on Amazon. First, we're going to peel off the backing. This Cover Roll tape is not supportive at all. It is not meant to be supportive, but what it is meant to do is provide a really good sticking surface for the Leukotape. So we're going to start actually on the top of the ankle. We're gonna cross over where they typically feel the pain right here. We're gonna end it on the arch. There's really very little tension with this because we're not actually trying to stabilize anything specifically with this tape. So we're gonna do the same thing. I'm gonna start it on the inside of the ankle. We're gonna cross that front. We want our X to be right where the pain is, and we're gonna finish it on that outside bone of the foot, what we call the base of the fifth. Okay? Then we take our Leukotape and we're just gonna follow the X's. This tape, even though it's very rigid, but it's also very easy to tear. So we're gonna start at the top and we're really going to pull. And if you get wrinkles, that's okay. The positioning, I forgot to mention, is going to be in somewhat of a neutral position. We don't want them completely relaxed, but we don't want them all the way up either. So again, we're gonna start at the top of the tape. We're gonna go all the way down, following the Cover Roll. Now, when the gymnast or dancer points their foot, it's going to block the front of the bone that's in the front of the foot called the talus, but it's also going to allow them to get into full plantar flexion. Now, if we want to, we can cover this up with more of the Cover Roll tape. You can just do 2 strips so that way it tacks down. Or another option would be to take kinesio tape of your choice. We're gonna just lay it down on the skin. We're gonna go pretty tight, again, through the area that's typically painful. We're gonna lessen up towards the bottom of the foot, and then as we come back up through, we're gonna put 100% tension and then just lay it down. Not only does this provide extra support, but it will tack down the underlying Leukotape. Again, the patient can flex or point their foot, and it's going to prevent excessive motion of the talus.